Gastrointestinal system sentences for listening and memory practice. Listen to the utterance. There is a pause after each utterance. Repeat the sentence after each pause. Try to focus on listening and retention so you can repeat back the message exactly as it was said in English. Do not interpret. This is memory practice in English. 1. GERD, gastroesophageal reflux disease. You have symptoms consistent with gastroesophageal reflux disease, or GERD, which occurs when stomach acid flows back into the esophagus. 'That reflux is likely causing your heartburn and regurgitation. 'I'm going to prescribe a proton pump inhibitor, PPI, called Prilosec to reduce the acid production. 2. Stomach ulcer, gastric ulcer. Based on your symptoms and exam findings, I'm concerned you may have a gastric ulcer, which is an open sore in the lining of your stomach. 'We will schedule you for an upper endoscopy called EGD to confirm the diagnosis. 3. Diverticulitis, diverticulosis. Your CT scan shows diverticulitis, which means there are small pouches in your colon that have become inflamed or infected. 'I'm prescribing antibiotics and recommending a temporary clear liquid diet. Once the inflammation resolves, we'll discuss prevention strategies. 'You also have diverticulosis, which means some of those pouches are present but not currently inflamed. Many people have diverticulosis without symptoms. Four, constipation. You're experiencing constipation, meaning your bowel movements are less frequent than 3 times per week and your stools are hard and difficult to pass. I recommend increasing your fiber and fluid intake. I may also prescribe a stool softener or a laxative to help regulate your bowel movements. 5. Diarrhea. You are having diarrhea, which means you're passing loose or liquid stools. Because this has lasted more than 3 days, I like to order stool studies to rule out infection. It's important that you stay well hydrated, and I may recommend an oral rehydration solution. 6. Hemorrhoids. Your symptoms are consistent with hemorrhoids, which are swollen veins in the rectal area that can cause pain and bleeding with bowel movements. I recommend increasing dietary fiber, using a topical hydrocortisone cream, and taking warm sitz baths. 7. Irritable bowel syndrome, IBS. You meet the criteria for irritable bowel syndrome, or IBS. This is a disorder that can cause abdominal pain, constipation, diarrhea, or a combination of both. We will focus on dietary modification, stress management, and possibly prescribe medication to manage your symptoms. Eight. Colon polyps. During your colonoscopy, we found and removed several colon polyps. These are benign growths, but some polyps can develop into colorectal cancer over time. Removing them significantly reduces your cancer risk. We will repeat your colonoscopy in 5 years for surveillance. 9. Cirrhosis, end-stage liver disease. Your imaging and lab results indicate cirrhosis, which is advanced scarring of the liver. Because some areas of the liver are no longer functioning properly, you're at risk for complications such as fluid retention and liver failure. We will refer you to a hepatologist and monitor you closely for signs of decompensation. 'What is decompensation? This is a stage of cirrhosis where the liver is so heavily scarred that it can no longer function properly, leading to acute, serious complications. Ten, jaundice. I notice you have jaundice, which is a yellow discoloration of the skin and the whites of your eyes. This suggests there may be a problem with bowel flow or liver function. I'm ordering liver function tests and an abdominal ultrasound to determine the underlying cause.